Hi everybody, welcome back to our EMT review, episode 3. In the first episode, we spoke about pulmonary embolism. Then we went on to patient assessment. Now we're going back to respiratory emergencies, and we're going to speak about a spontaneous pneumothorax, or in Hebrew known as a chazeh avir spontani or PNEUMOTHORAX spontani. I was asked if I can throw in a little Hebrew in the terms. Thanks for your feedback. In general, it's very much appreciated. A spontaneous pneumothorax is where air spontaneously leaks out of the lung into the pleural space, causing air to build up and put pressure on the lung, causing it to partially collapse, making it difficult to breathe, which usually will have a sudden onset and gradually get worse. This is also going to cause unilateral sharp chest pain. Now, this is most common in otherwise healthy, tall, skinny males, which is usually the result of blebs forming on the lungs, which ultimately burst. These blebs are little air, weak spots on the lungs from the lungs being overstretched, and then they can burst. Interestingly, with primary spontaneous pneumothorax and otherwise healthy individuals, it may happen in their sleep or even at rest. This is also prone to happen in patients with underlying lung disease, like patients with COPD, cystic fibrosis, lung cancer, or other things like that, where as a result of the diseased lungs, it makes them more prone to get a spontaneous pneumothorax. That usually would happen after a heavy cough or some strenuous activity. Now, your treatment is going to be the same as with any other respiratory emergency. You're going to make sure you sit them up, give them oxygen with a non-rebreather mask on 10 to 15 LPM, and call for ALS. Now, a way to distinguish this spontaneous pneumothorax with a pulmonary embolism, right? We said the symptoms are very similar. Both cases, they're going to have difficulty breathing and sharp chest pain. However, there are certain things that we can use to distinguish. So now, first of all, with a pulmonary embolism, usually it's a sudden onset in its severity for the most part, whereas with a spontaneous pneumothorax, the pain is going to be gradually getting worse as more air builds up. If you're auscultating lung sounds, of course, you'll be able to hear decreased lung sounds with a spontaneous pneumothorax on the side of the pneumothorax. But another thing is that you can also always want to take a look at the legs. Usually with a pulmonary embolism, if it's caused from DVT or deep vein thrombosis that came from a deep vein, you'll probably see swelling in the lower leg, whereas you wouldn't have that with spontaneous pneumothorax. But it doesn't not necessarily. Obviously, we're taking risk factors into account. With pulmonary embolism, they're likely to have, usually some DVT, or a patient having been immobile or having taken contraceptives, or pregnant women, cancer patients, right? Things that are more likely to cause clots, whereas with a spontaneous pneumothorax, you don't necessarily have that. Now, in rare circumstances, a spontaneous pneumothorax can deteriorate into a tension pneumothorax. That's if the air keeps building up, causing the lung to collapse completely. That will result in pressure buildup against the heart, right? A tension pneumothorax. This is actually a type of obstructive shock because it's putting pressure on the heart and decreasing its ability to pump. It's very rare that a spontaneous pneumothorax will deteriorate into that, to that, because usually it'll kind of resolve on its own. Bottom line is, although your treatment is going to be the same, it is important for us to try to be able to distinguish and understand what's going on and collecting our information. Alrighty, that's going to be it for today, and we'll see you in the next episode.